Hi, I'm Gyasi Appiah. I'm a postdoctoral research fellow at the Icahn School of Medicine in New York, where I conduct research specifically looking at the epigenetic regulation of immune response in inflammatory diseases. Today, I would want to talk to you about a disease that affects the gastrointestinal system. And this disease is known as inflammatory bowel disease. Now, the gastrointestinal system is the system that's responsible for the digestion of food and also the absorption of fluids and nutrients. Now, the gut is constantly exposed to a variety of antigens from, for example, food, as well as microbes, both resident and invading microbes, and also to stresses such as toxins from drugs. And because it is constantly exposed to some of these stresses and antigens, it is a site where diseases are likely to develop. And it may also serve as a portal through which diseases may develop at other body sites. Inflammatory bowel disease, which is the disease that I would want to discuss with you today, is a broad term that describes an autoimmune condition that is characterized by chronic inflammation within the gastrointestinal tract. Now, when we say a disease is an autoimmune disease, it means the body's own immune system attacks itself, leading to the development of disease. And IBD, or inflammatory bowel disease, is mostly characterized into two groups. That is Crohn's disease and ulcerative colitis. In Crohn's disease, you have inflammation occurring in any part of the gastrointestinal tract, whereas inflammation mainly occurs in the large intestine, that is the colon, in ulcerative colitis. Now, globally, it is estimated that about 6.8 million people are living with IBD. Actually, this number increased from 3.7 million in 1990 to 6.8 million as of 2017. And so I'm very sure that by now the numbers have really increased. And according to this 2017 estimate, more than 1.5 million people in Europe and 2 million people in North America have inflammatory bowel disease. And only in the United States, there are 70,000 new cases every year. Now, it has been also seen that there is an increase in the prevalence and incidence of this disease in industrialized countries as well as newly industrialized countries. Now, what are the possible risk factors for the development of inflammatory bowel disease? The first is the genetics of an individual. Depending on your genetic makeup, you are likely to develop this disease. Secondly, the composition and function of our intestinal microbiota may put us at risk of developing this disease. Now, our intestinal tract is home for a lot of microbes or microorganisms. And so depending on what kind of microorganisms are inhabiting your gastrointestinal tract and the function of these microbes, you may or may not develop IBD. Then again, as I mentioned, this is an autoimmune disease, which means that the body's own immune system attacks it. And so your immune response within your gut and also within your entire system may predispose you to develop this disease. And there are also other environmental factors that are likely to lead to the development of IBD. And these may include lifestyle. And when we talk about lifestyle, we can talk about stress, smoking, lack of sleep, lack of exercise. All these may be contributing factors that may lead to the development of IBD. Our diet is also one of the risk factors. The food we eat may or may not predispose us to develop IBD. Medications that we also take can lead to the development of IBD and also several other infections. Now, what are some of the signs and symptoms of IBD? Some of these may be non-specific, and so the fact that you see these may not necessarily mean you have IBD. However, if they become chronic, then there is cause to see your doctor for further investigations to establish a diagnosis. And one of these symptoms is abdominal pain. Other symptoms include chronic diarrhea, blood in stool or rectal bleeding, unexplained or unintended weight loss, as well as fatigue or weakness. Now, there are a lot of complications that are associated with inflammatory bowel disease. Some of these are within the intestine, others can be extra-intestinal. Extra-intestinal in the sense that these complications may occur in other parts of the body aside the intestines. Now, the intestinal complications may include anal fistula. Anal fistula is a small tunnel that may develop between the end of the bowels and the skin near the opening of the anus. And we can also have another complication being anal fissures, which are small, painful tears in the lining of the anus. There may also be abscesses in infected cavities, and these abscesses are basically filled with pus near the anus or the rectum. Some other complications include colorectal cancer, intestinal obstruction, perforation, toxic megacolon, which occurs when there is swelling and inflammation spreading into the deeper layers of the colon. As a result, the colon may stop working and it will widen, and in severe cases, the colon may rupture. There can also be malabsorption. Now, with the extra-intestinal complications, you can have several complications in the eye with conditions such as conjunctivitis, uveitis, in the gallbladder, in the kidney, in the skin, the liver and bile duct, bone and joints. So there can be several other complications happening outside the intestines in other parts of the body. Now, treatment and management of IBD depends on the severity of this disease. So for milder conditions, there are drugs that are given to treat the inflammation or to tone down the inflammation. But in very severe cases, a patient may have to undergo surgery to treat this disease. Now, like I mentioned, our diet can also be a major risk factor for the development of inflammatory bowel disease. And so one of the ways to treat or manage IBD is to look at our diet. Now, we need to avoid fatty diets and also eat less red meat as well as less processed foods. Now, our diet should be more of vegetables and fruits, and also soluble fiber and healthy fats. Healthy fats such as olive oil, non-hydrogenated nuts, and seeds. These may be helpful in protecting us against developing IBD. Now, as I also mentioned, stress can also predispose us to developing IBD. And so it is very important that we are able to manage stress. It is very also important that we have very good sleep. And so in managing stress, we need to be able to socialize with people. We need to have adequate sleep and rest. We need to exercise. And when you feel like you are overly stressed, you need to seek professional support. Stress management is actually a topic on its own that can be treated into details. So, in conclusion, I would say that IBD is a chronic disease of the gut which may have debilitating effects on an individual, and that appropriate diet and lifestyle may help in preventing or slowing down disease progression. So with this, I'll bring my talk to an end, and I hope to see you again next time.